Necessary components of the FMS Duo Plus system include the Duo pump, a power cord, a 4-way foot pedal. This version is using another company's shaver system. They can use a 2-way foot pedal, a shaver handpiece with connection cord, an optional FMS grease collection pad, inflow and outflow tubing. If you're certain to use another shaver system, they can use an FMS shaver interface cable to use their own shaver. Attach the multi-pin connector. Attach the power cord to the battery. Turn the main power button on the battery. Then turn the power button to the also see a green LED light blinking next to the red stop. Connect the FMS Tornado shaver to the primary pump. Be sure to line up with the red dot. If you're using another company shaver, first attach the multi-pin connector to the back of the pump. Then attach the interface adapter to the shaver console. Where you can normally use a connection shaver, and now connect the shaver to the interface adapter. Have the circulating air flow in the green package with the irrigation tube applied. Be sure to close all. Place the pressure chamber into the holder. There's a groove near one end of the chamber. Slide it into the holder and make sure it remains on the chamber slightly left before turning clockwise. Make sure it's tightly secured. Close the cover and make sure it's flush against the pump. Important to ensure the cover is fitting the pump all times. If it stop working, remove the tip covers from the ends of the tube despite your safety. Unplant the white tip on the tube. Press the run stop button. The LED will stop. Press the fill chamber and fill the pressure chamber. The water tank chamber. Repeat approximately 3 times until the chamber gets about 1 year full. Do not push the button 3 times. Have the sterile nurse open the orange package labeled Sterile Zone Kit with check valve. Unpack and separate the intermediary tubing and the outflow tubing. Make sure the white and blue connections on the check valve of the intermediary tubing is tight before passing off the circulating nurse. Remove the blue caps on the far end of the check valve and the irrigation tubing below the pressure chamber. Immediately connect the irrigation tubing motor lock to the intermediary tubing motor lock. Open the clamp under the pressure chamber. Find the white piece of tape holding together the outflow tubing. Hold upright and let the waste tube fall. Have the sterile scrub tech pass the end labeled waste to the circulating nurse and insert into the waste collection bag. Remove the white tape and find the orange connector on the suction tube. With the semicircle facing up, place it into the sliding notch located near the suction pump. Notice the arrows on the tubing are pointing up facing. Place the center tubing around the roller pump, pulling on tubing slightly, close tension rocker and locking arm. Starting with the outflow tube, the tube closest to the outside of the pump, slide it snugly into the pinch valve slot. Press the pinch valve button and slide the other tube into this slot. Make sure both tubes are placed behind the holder under the pinch valve. Close the cover and make sure it's flush against the pump. It is important to ensure the cover is touching the pump at all times. The pump will temporarily stop working if it isn't flush. Look for the open end of the intermediary tubing labeled inflow. Connect the red lure lock to the scope sheet. Open the white clamp. The FMS Duo system requires a scope sheath with an inside diameter of at least 5.8 millimeters. Ask your DePuy MyTech rep to confirm this is the case before surgery. On one end of the suction tubing, there are the words labeled outflow cannula. Place this end into the outflow cannula. Make sure the red clamp is open. The other end of the suction tubing says shaver. Insert shaver tubing into the shaver suction port. Make sure the suction toggle is open at all times. Open the stopcock on the scope cannula in the sterile field when you're ready for surgery. Close the clamp under the pressure chamber. If you want to empty excess fluid and debris from the patient's joint, press on the blue cannula suction foot pedal. Disconnect the blue lure lock under the check valve of the intermediary tubing. If other surgeons are scheduled for cases the same day, leave the check valve attached to the irrigation tubing. To use existing tubing for the next case, make sure the irrigation tubing has been left in place at the end of the previous case. Open the orange tubing package and separate the tubing in the sterile field. Make sure the new lure lock is tight on the new check valve. Remove the old check valve. Immediately connect the blue lure lock on the new intermediary tubing to the blue lure lock on the irrigation tubing below the pressure chamber. Open the white clamp under the pressure chamber and set up this suction tubing as previously described. Set the pump to 50 for a shoulder case. Read your quick manual for recommended settings for all other cases. Cannula suction should be set to medium. Shaver suction should be set to low. Set your shaver controls as desired.